Hello, I'm Elaine Flint. I'm the VCSE Advocate to the Health and Wellbeing Board, as well as Chief Exec at Wellspring Healthy Living Centre. The last Health and Wellbeing Board was 16th of December, and there were a couple of key things within it. Most of the meeting was taken up with talking about three big areas of commissioning. One of which is going out to tender in January, which is the Children Community Health Services. So this is going out to tender in January for a service start in 2017, so it's a very huge piece of work. The other two were really are still at consultation stage, so it was just an update. One was around the adult social care community support services, and the other one was the sexual health services recommissioning. So those are still at consultation stage, and I know VCSE has been involved with both of those. The other thing that came up was there's going to be a refresh of the health and wellbeing strategy for Bristol. This was flagged up last time, but I asked when it was going to be, and they're actually going to hold off until after the mayoral elections, so it won't be till the second half of 2016 that they'll have a small steering group really to sort of be working on that strategy refresh. There was also a short presentation by Becky Pollard, the Director of Public Health, around their budget allocations for 2016-17, where they are expecting an 8.4% reduction, which amounts to a reduction of £3 million in the public health budget. They'll be notified of the allocation in January, but clearly that's a major issue, and obviously a lot of voluntary organisations, including my own one at Wellspring, actually do a lot of work with public health, and public health funding is very important to us, so that's something to watch very carefully. There was also an update of a draft update on the Joint Strategic Needs Assessment 2015, and a couple of key headlines there really is that deprivation and inequalities are not on the wane, they're on the march. There are now 6 super output areas that are in the 1% most deprived in England. In 2010 there was only 1 in the most deprived 1%, so it's gone from 1 to 6. The new 5, the additional 5, the original one was here in Barton Hill, in East Bristol. The additional 5 are all in South Bristol, so that's the depth of deprivation. And in terms of the health inequalities, again, no improvement in the key indicators of health inequalities. Life expectancy gap between the richest parts of Bristol and the poorest parts of Bristol still means that there's men die 9 years earlier, women die 6.5 years earlier, and the expectation around healthy life, i.e. how many years you are active and healthy, for both men and women, between the richest areas and the poorest areas, there's 16 years of a gap, and that is very high in England. That actually is a very high gap, so that shows that's the impact of inequality, social inequality, and its impact on people's health and life expectancy. So those were the key things that came up at the meeting. Again, not a lot of decisions. It still feels to me very much like it's a rubber stamping. It's a sort of the end of the line where things arrive, where they've got to be signed off. And for example, the Children's Community Health commissioning, which was the biggest decision on the agenda, in effect, has to be taken by the mayor. So actually it comes to the Health and Wellbeing Board, but it's the mayor who actually takes the decision. So that's the sort of legalities that are weird and wonderful about it. So that's my report. Thank you.